How does smoking increase bladder cancer risk? Imagine your body as a complex system where everything is connected, and what you breathe in can affect your health in surprising ways. When it comes to bladder cancer, smoking plays a significant role because of the harmful chemicals in tobacco smoke. These chemicals are absorbed into your bloodstream when you smoke and then filtered by your kidneys. As your kidneys process these toxins, they end up in your urine, which is stored in your bladder. This means your bladder lining is exposed repeatedly to these dangerous substances. Many of these chemicals, called carcinogens, include aromatic amines and tobacco-specific nitrosamines. These substances can damage the DNA inside the cells lining your bladder, known as urothelial cells. When DNA is damaged, it can lead to mutations, which are changes that might cause cells to grow uncontrollably and from cancer. The more you smoke, the more these carcinogens build up in your urine, increasing the chance of damage and cancer development. The risk of bladder cancer rises with the amount of smoking. If you smoke more cigarettes each day or have smoked for many years, your risk goes up. This relationship is called a dose response. Studies show that current smokers are about 3 times more likely to develop bladder cancer than those who have never smoked. Even people who used to smoke still have a higher risk than those who never smoked, but quitting can lower this risk over time. Interestingly, even after quitting smoking, the risk of bladder cancer stays elevated for many years, sometimes 20 years or more. This is because the DNA damage caused by smoking can have long-lasting effects on bladder cells. Over time, the risk gradually declines but may never return completely to the level of someone who never smoked. Another point to consider is that cigarette manufacturing has changed over the years. Modern cigarettes often contain higher concentrations of certain carcinogens, such as beta-naphthylamine and tobacco-specific nitrosamines. This might make smoking even more dangerous for bladder health, despite reductions in tar and nicotine levels. Smoking not only increases the chance of developing bladder cancer, but also affects the course of the disease. Smokers are more likely to experience cancer recurrence after treatment, especially in the most common type, called non-muscle invasive bladder cancer. This means that smoking can make managing and treating bladder cancer more challenging. In Europe, research shows that smoking is responsible for about 43% of bladder cancer cases in men and 26% in women. This highlights how important it is to see smoking as a modifiable risk factor. Quitting smoking can significantly reduce your risk over time, although it may not eliminate it entirely. That's why health experts strongly recommend avoiding tobacco and quitting if you already smoke to protect your bladder and overall health. Remember, understanding how smoking impacts bladder health underscores the importance of making informed choices. If you're concerned about bladder cancer or your risk factors, talking with a healthcare professional can help you develop a plan to stay healthy and reduce your risk.